The Dunn County Criminal Justice Collaborating Council is celebrating our 10-year anniversary this year. The mission of the Criminal Justice Collaborating Council is to collaborate to be more effective and efficient in our local criminal justice system.
If we actually sat down and tried to figure out how we could approach different concerns or issues within the system, that maybe we could do it better. It's taken a lot of work, a lot of effort, and a ton of discussion, but it's led us to take those steps where from where we started 10 years ago and where we are now, we have found that we do have the ability to work together.
And again, we have to keep in mind our core value of public safety is number one. But with those people where the primary goal is to change their behavior, then public safety comes along with that change of behavior. And so the thing about the evidence-based decision making is it employs principles that are, for example, in behavioral psychology, principles that we understand actually work in changing behavior. We found that over the years this has really been something that has, there are many cases, such as our drug cases and other nonviolent cases, it's been much more successful than some of the more traditional methods of just punishing people. And you get somebody, turn them into a tax-paying citizen, someone that may have their children back, and they're no longer committing crimes in the community. Every person that you turn around like that saves you a significant amount of money, resources, and so on.
I've had deputies complaining for years. We keep seeing the same people over and over and over, and jail hasn't done it. Citations haven't taken care of that problem. I hear deputies on the road complain about the people that we have contact with that have mental health issues, have contact with the jail staff, and they say the same thing. We keep having so many people coming in with mental health issues. And I see the CJCC and the different work groups we have as an opportunity to try to figure out why we keep having the same people come back and see if we can actually do something about it.
There were a lot of jails that were experiencing significant overcrowding, and the determination that a lot of that overcrowding was a result of people who had mental health and substance abuse issues being incarcerated. But the Stepping Up initiative has been able to infuse a life in Dunn County into the focus of really taking a deep dive into looking at how we do a better job of serving folks who have mental health and substance abuse in our community. People who have an identified serious mental health or substance abuse diagnosis are incarcerated for much longer periods of time than people from the general population or people without those diagnoses. And sometimes up to 2 or more times as long of an incarceration. In some respects, that might not be troubling to some people. However, if you think about 2 people committing the same offense and you think about the concept of justice, it seems unjust to know that someone who has a mental health and substance abuse diagnosis is going to serve a longer sentence, serve a longer period of time, not necessarily a sentence, just because of their diagnosis. So Chief Eric Atkinson of the Menominee Police Department made a commitment to train all of his staff in a model called Crisis Intervention Teams. It's an evidence-based model that's practiced in various municipalities and counties around the country. The Dunn County Sheriff's Department has joined in that initiative, and between the 2 organizations have trained well over half of their staffs, which has been a major accomplishment.
We find that it is utmost important for our officers to be highly trained in how to handle mental health disorders or people that are suffering from that illness. That could include anything from anxiety. It could be psychosis, it could be post-traumatic stress disorder. And so it's a real issue that is in the forefront for law enforcement because we handle these types of calls on a regular basis. Individual training for officers in learning how to communicate with people that are suffering out there in the field with mental health disorders is they learn how to calm the situation down. Patience is very important. Communication skills, being clear, being articulate on what the expectations are, providing space. CIT is centered around distinct pillars, and it's the concept behind it is bringing everybody into the room and building partnerships or relationships with one another to figure out how we can provide resources and educate everybody that becomes involved and how this affects the community.
Sure.
And
On the backside of the interventions that we have been working on for stepping up, we have received a large $80,000 a year 4-year grant to look at jail reentry, which sounds like we are trying to get people to reenter the jail, but in reality we are trying to look at community reentry from jail. And we know that we'd like to eliminate the revolving door that some people experience.
Currently, we have about 26 individuals started in our reentry project, working towards creating a really individualized plan for them based on what their needs are, specifically when it comes to whether they have mental health, AODA, dental issues, things involving human services and their children. So it's really geared towards meeting their needs and what they really need to focus on when they get out of our jail and what we can do while they're still in our facility. This is really important to trying to close the gap and hopefully prevent and reduce the recidivism risk for people so we don't have them coming in. The majority of our people that are in reentry have been here more than 10 times, up to 30 times been in our facility, so they really need a program or a project such as this.
But our recidivism runs at about 55%. The best predictor of coming back to jail is coming to jail the first time. And that's kind of a sad fact of life. So if we can try to break that cycle, I think that'd be a good thing for everybody.
Approximately 2 years ago, the Menominee Police Department and other law enforcement agencies of Dunn County implemented the Law Enforcement Proxy. The Law Enforcement Proxy is an evidence-based tool that is utilized to determine better outcomes for our offenders. In other words, we have discovered through sociological research that if we can identify a person being either a low-risk, medium-risk, or high-risk offender, we can determine the likelihood that they might recidivate and repeat a crime. So if we determine that a person is a low-risk offender, we have the option of diverting them out of the criminal justice system with other alternative means, which includes education or community service, thus allowing us to focus our resources on medium and high-risk offenders here in Dunn County, which allows us to give those resources to those people that need it most. And with those low-risk offenders that we have diverted out, we have found that if we do not intermix them with our medium and high-risk offenders, the likelihood for them to re-enter the criminal justice system goes down dramatically.
Well, the pre-charge diversion program is for individuals who have little to no criminal history. The purpose of the program is to work with those individuals who might find themselves in a situation that might be out of character for themselves, that might lead to a criminal charge. And that criminal charge could then follow them for a number of years, having an impact on them. The program would give them an opportunity to complete an agreement, and if they successfully complete that agreement, at the end of the agreement, those referred criminal charges would be not filed with the court and then not on their criminal history.
So as a prosecutor, every time we look at a resolution for a case, we look at 3 things: the seriousness of the offense, the need to protect the public, and then the rehabilitative needs of the defendant. So here in Dunn County, we're very fortunate that we have a number of different programs. We have the pre-charge diversion program for our first-time low-risk offenders. Then we have the treatment opportunities program, our TODD program, for individuals with AODA and mental health needs. And then we also have just a plain, deferred program. The benefit for our office is it's getting those individuals the treatment that they need, so hopefully we don't see them again. But it benefits the defendant as well, as they could have their charge dismissed if they do a deferred agreement, or it could be amended down to a misdemeanor. We also have, for certain repeat higher risk individuals, we can put them on probation for a misdemeanor and then also have them on a deferred agreement, so that's held open on the felony charge. And so really our ultimate goal here is to make sure that the community is safe, people are still being held accountable, but that we don't see them again. And I can't tell you how many times we see the same individuals over and over again. And I really do believe that Dunn County is at the forefront of having these different programs that my office can use as tools to deal with the number of defendants that we have here in Dunn County.
From a law enforcement perspective, I believe the treatment court provides the necessary tools for the participants to be re-entered back into society and become a valuable member of society, being productive and make a seamless transition back into the workforce and getting their life back on track.
Dunn County's treatment court started in 2008 as a problem-solving court to those involved in the criminal justice system who also have substance use disorders. The purpose is to keep those with substance use disorders away from long-term jail or prison sentences and in turn get rehabilitation and treatment services to keep them an active participant in our community. The average recidivism rate for someone released from prison after 5 years is 76.6%. Those who have graduated our treatment court here in Dunn County have a recidivism rate of 12.5%. The data shows that the program is working well and reducing recidivism, but also keeping our community safe.
DECT stands for Drug Endangered Children. Now, DECT program is a national organization that Dunn County has adapted to assist families that have been affected by drugs. One of the most catastrophic drugs in our community today is methamphetamines. Methamphetamines not only affects a person using methamphetamines or manufacturing it, but it also affects the people that live in that same household or the kids that are directly involved in that family. These environments that people are using or manufacturing meth create a toxic environment. And when these children have to live in these environments, we're finding out that these children are now testing positive for methamphetamines. They take the methamphetamines from walking around, from crawling on the floor, from putting toys in their mouth, from finding drug paraphernalia that might be left out unattended. So because law enforcement can't do this by themselves, we have collaborated with the other agencies in our community. We see that this is a team effort. This is going to take more than just us to help out the kids and that are directly involved or directly affected by this drug.
So the Treatment Opportunity Program, it's a voluntary pretrial program. It provides people with case management, treatment, and drug testing. The people who are involved in the program are usually, they're nonviolent offenders, and they are brought into the program based on alcohol or drug-related offenses. So treatment is a really important portion of this program. They are assessed for treatment needs, for their alcohol and drug abuse needs, and also their mental health needs, and they're set up with that treatment. Once that has been completed or the requirements have been completed, their charges are dismissed that initially brought them in. So that can be a benefit and that can be a motivator for people to get done what they need to get done through the program.
One of the things that the CJCC has been able to accomplish is to really bring people together who have a heart for having positive outcomes for the work that we're doing.
When we work together and we put all of our minds together and tend to think outside of the box, we can create some really unique programs that can make a difference.
We can continue to modify, enhance, adjust direction by adapting to what's more appropriate to use in solving the many issues and problems that the criminal justice system presents. And we can do it together.
Dunn County Criminal Justice Collaborating Council would like to thank you for your time and attention and continued support. And we look forward to continuing to serve Dunn County and delivering an effective and efficient local criminal justice system.